this space this morning. So again, good morning and welcome everyone. My name is Denise Rory. I'm one of the community engagement managers with the Office of Student, Family, and Community Advancement. And I want to welcome and thank you for joining us this morning on this lovely summer Saturday. From our parents to our teachers, our students, support staff, partners, community leaders, and city leaders, we thank you for joining us this morning. I want to take a moment to introduce you to the folks on your screen. Again, my name is Denise Rory, and I want to thank the community engagement team, our director, Miriam Ortiz, and our managers, Crystal Cummings and Jelani Haynes. For organizing these sessions. We've been working to try our best to get as many sessions as possible on the calendar for your feedback and engagement. Also want to welcome and thank Tess Atkinson, our Assistant Chief of Staff, for helping to support us today, as well as Charles Granson, our Chief of Equity and Strategy Officer, Monica Roberts, our Chief of Student, Family, and Community Advancement, and of course, our fearless leader, Dr. Caselius, our superintendent. So we're super excited this morning. This is our first webinar, and so far we are at our largest group of community members to join us. So again, thank you so much for your time today. Just to give you a little snapshot of where we've been in terms of engagement, this is our 22nd community meeting. So far we've engaged with young people, parents, including our English learner parents, BPS teachers and staff, including nurses and custodians, BPS principals, BPS partners, and BPS advocates. And we really appreciate everyone's really helpful and insightful recommendations and suggestions and questions and concerns around the reopening of schools. And again, your willingness to come to the table during these extremely difficult, stressful, and uncertain times. Our objective this morning is to get your thoughts, suggestions, and concerns around fall reopening. We will also give you a snapshot of where the district is in their planning for reopening, and we welcome questions and recommendations from the wider community. And thank you for all of your help and support thus far. And without further ado, I will turn it over to Dr. Caselius.
Well, good morning, everybody, on this sunny and hot Saturday morning. I'm just really thankful that you've made time today to really get to know a little bit more about our plans, preliminary plans for the reopening of school. Of course, much of this is still in flux. We have about 7 weeks for our target date of what was typically on our calendar to start on September 10th. However, we are still only in the draft stages of this process right now. We are at the place within our equity framework to look at stakeholder engagement more deeply, to provide feedback and to look at our racial equity lens in how we assess and what we do in terms of our reopening to ensure that we have a safe and successful reopening for our children and for our staff and teachers. And so this is still a work in progress. Of course, we know that there are still decisions coming from the state around transportation that we were just issued late on Thursday night. There are issues from the state that are coming around athletic guidance. There's more guidance that has come around procedures to do if we have illness. We just got guidance around art classes and specialist classes and PE classes, which just came also late this week. So as we know, this is a continuing, evolving situation. And so I just wanna really ask for people's patience as we try to work toward getting our kids back in school as best that we possibly can with the most amount of frequency for our students, because we all know the best place for our children is back in school for their own wellness, health and wellness, for their academic and also for their child development and peer-to-peer relationships that they have. And I know a lot of you and your if families are anxious to have them back at home too, as well as our teachers are very anxious to have them back as well. But we all also know that our top priority is also going to be about safety. And so we want to have the time over the next 7 weeks to demonstrate to our public that we are ready for this and we are prepared as a staff to be able to receive the children and to do so safely. So it's really important that the public continue to stay up to date. I will continue to find ways to make sure that all of our communities understand and know where we're at in the process, what the planning has gone on in the process, what facility changes we might be making, what type of supply chains we might be using for cleanliness or for our protection, our safety protection. We'll be working closely with our nurses. We'll be working closely with our teachers over the next several, and our central office staff over the next 7 weeks to cross our T's and dot our I's and make sure that we've done everything that we possibly can. And if we don't feel comfortable doing that, we will either push off the date to a later date when we are ready, or we will, stagger the start. There are all kinds of options for us as we go forward, but we want to make sure that every single school is ready and safe. One thing to note is that we will be undergoing more of a school by school reopening planning with school parent councils and with the principals and their equity roundtables. That will happen in August when the school leaders are back sometime during mid to late August. Typically we have open houses where parents come in and they get their schedules and they have all of the opportunity to meet their teachers. We'll still do something like that. It will just be, it may look a little different, and that is not yet planned. And I think that also will help parents understand and see all of the protective equipment and all of the protective routines and protocols that we have in place, and teachers will have opportunity in which to get comfortable with those prior to school start. So with that, I want to go into my presentation, and then after that, I'll take questions. So very much thank you for being on this call. And please stay abreast at bostonpublicschools.org/reopening. Okay, so everyone's goal is that we are able to create spaces where children are learning and they are joyfully learning, both academically and social emotionally, where they are able to thrive with their peers and interact with their teachers and be able to have a strong sense of community and connectedness. Next slide. So these are our beautiful children. And I know this probably brought a smile to everybody's face, because this is the kind of joy that we want to try to create as best we can. However, we know that there are rules in which we cannot create it exactly like it looks right here. We know that children will not be able to be hugging like they are right here. And they will need to have face masks on. And they will be working remotely at some part of the time, as well as with all of the wonderful paraprofessionals and supportive professionals, school psychologists, social workers, nurses, custodians, and others who just give our children so much love and caring during the school day, because our goal is that every child is able to graduate on time with all that they need and the supports that they need to be successful in whatever they choose as their next step. Next slide. So I wanted to just review very quickly the community engagement and listening that we've done so far that has formed the plan to where we're at right now. We've had 14,000 respondents to family surveys. We also had a student survey and teacher survey that we provided. We had specific feedback on remote learning as well, which has guided our thinking around the best place for students is in school. We've had 20 community meetings with stakeholders completed so far, And we've also had several language-specific meetings to reach our various communities. We will still continue these language-specific meetings to be sure that we are reaching our entire population and finding new ways to connect with parents and understand better their concerns and their suggestions and answer their questions. We've been meeting with employee groups, central office staff, custodial staff, our facility staff, our health and safety and food nutrition staff, our nurse faculty senate, and we have been meeting with our teachers. We have had meetings with our students. I meet with them all nearly weekly. There have been a few I haven't been able to attend, but nearly weekly I meet with our Boston Student Advisory Council. And we also have bi-weekly meetings with the City of Boston team to collaborate a citywide focus. And I'm actually on citywide calls twice a week now. And during the COVID crisis, we were on calls every morning at 8 o'clock with the city, coordinating effort and coordinating response. So we are very highly connected with Chief Martinez and the Health and Human Services Department, Dr. Lowe and Boston Health Commission, and also the State Department and their work that they're doing there in terms of the guidance that the state is putting out and monitoring this daily and getting updates from Chief Martinez. We will be using science and our numbers to be able to determine the safe reentry of our children. We also have had BTU focus groups around remote learning specifically. We started those in May and June and getting and understanding better specifically within special ed and EL instruction, what worked, what didn't work, and technology integration, and then issues with how do we support families and what do we need to do with the remote options, whether we're fully remote or whether we would be hybrid to support our families better than we did this spring. It's one area I'm very concerned about because I know families need a lot more support in order to help us deliver a high quality education for our children. And then also we have been working with our school leaders and keeping them up to date on planning in huddles and fireside chats and in specific principal meetings. Now, as we shift to a more robust planning process over the next 7 weeks to really look at this hybrid model and unpack it and make sure that we can do it well before we actually open the doors. We are looking to work more closely with our school leaders as well as our teachers and our nurses to make sure that we have everything in place, that we've walked as a team our buildings, that we can cross our T's, dot our I's, and everybody has the training that they need necessary for students to come back safely, and that all of our PPE has been ordered, it is on site, that you know, any of the protective equipment that we have has been on site and ordered. So all of that is something that we are looking at right now. Next slide. So I wanted to just go through a few core values that is driving our work. And the first one is, of course, about equity. We have been applying the racial equity toolkit that Boston has had for many years to our processes at every single level and within every department. And we have a coordinated equity response now that we have been pulling the team together and will be going through. We are in the stage now around stakeholder engagement after gathering data and identifying the problem. And then we will be applying that racial equity lens through our equity roundtable and convening with our equity roundtable, which we started convening the week after we closed from the coronavirus. So that roundtable has been convening since the week after we closed in March 17th, and we'll continue to convene now twice every month as we continue this process moving forward. We also want to protect public health, and that is absolutely essential for all of us. I can't tell you how important it is that for us to reopen schools safely this fall. It will be incredibly important for all of us right now to continue to be disciplined around our wearing of the masks when we go out in public, very disciplined about our social distancing, when we are in family groups or mixed family groups, such as a funeral or a barbecue or a get together for a party or wedding or something like that, that we are very cognizant of our social distancing and the wearing of our mask and constant hand washing. It's just very, very important that we are able to do that now in the community so that we do not get community spread. We also have a huge value and guiding principle around increasing the quality of the student learning and the supports that they're receiving around their social emotional well-being. This is, we have held focus groups since May and June with our teachers to better understand remote learning, what worked, what didn't work. We were looking at our data and unpacking and understanding that data as well, and trying to see where our students thriving and in which settings for teachers who are getting it right. And then also where do we need to provide additional training and support and sharing among teachers. I always say teachers learn best from other teachers. And so how do we create those conditions so that teachers can share their best practices around improving student learning in a remote environment as well as an in-person environment, which may look a little different than it has previously during pre-COVID. We also want to support our parents and their families and how they support children. And then also supporting our teachers, our workers, our staff, and what do they need to be able to do this, do it well, and to feel supported by the district, and to have the resources necessary so that they can get the job done. And then of course, we have to also account for any of our specific staff abilities as well as the abilities of our children and making accommodations on a case-by-case basis. So as I talked about, health and safety is a huge, big concern, as well as understanding science. And we're going to have our decisions informed by science. I am not a scientist, although I really enjoy science. And I actually answered those questions on trivia much better than other ones. But I will be looking to the city and to my colleague, Chief Marty Martinez, for guidance regarding all matters of COVID and the COVID response. And he has just been a terrific partner and on call whenever I need him to advise. We'll also be dependent on our school nurses and their incredible expertise for what school nursing looks like and how we service children and families. And then our many partners outside of the city and outside of our nurses, like children's and our pediatricians and all of our coordinated behavioral health services partners who are going to be working with us to make sure that we are answering questions and addressing all of the concerns that you all have. Right now, in terms of our incidents in Boston public schools, in Boston area, our weekly positive rate in Boston is 2.1. The state positive rate is 1.8. We are among the lowest in the country. I know many people are seeing surges and watching the news like I am watching the news in other states. We just simply are not seeing that here in Boston and in Massachusetts. Our numbers flattened, and it is because our community has pulled together as a village to keep our numbers down, and that has meant less death, that has meant less illness and less impact on our families. However, what we do know is that disproportionately our Latinx community and our Black communities and certain neighborhoods are impacted more by this virus, and we need to be attuned to that inequity within our system and do everything we can to support our communities and support the schools that will be serving children within that community. So we are putting together a specific racial lens for specific communities where we see an uptick that's disproportionately higher than the overall rate within Boston. So just know that is on our radar, and we are paying attention to that and working with the city to bring those numbers down. Next slide. So we've been planning probably since we heard that we would be going longer, April 27th, when we knew that was going to stop our supplemental learning and that we would be closed until the end of the school year. We then began to shift quickly to remote learning and then summer planning for summer learning knowing that we would have to have a more coordinated response for our reopening in the fall if that was going to be something that we were going to do. So I had appointed a special advisor that I brought to work on special education for me, Tammy Poost, who has a lot of experience in administrative logistics and compliance, and to lead this effort because of her qualifications around compliance, around administrative function, or risk management, and making sure that we are coordinating our efforts across departments. So we have the academics department, which will bring recommendations to this coordinated response team. We have student health that has been bringing recommendations to this coordinated response team, as well as food nutrition, transportation, facilities, human capital, community engagement, and all of the feedback that we're getting to inform these decisions. Communications, and how do we better communicate all of the work that we're doing. Technology, and how do we integrate technology solutions to help us meet our goals. And then partnerships and athletics. Partnerships meaning folks like City Year, Sociedad Latina, our partners with our community partners, nonprofit partners, our health partners that I talked about early. How do we make sure that they're involved and working with us closely, because we think they're going to be a very key solution to that out of school time if we do end up being in a hybrid model. Again, we've applied this equity frame in each of these buckets, and then last week began a coordinated equity roundtable to be able, internal equity roundtable that will inform our larger district-wide equity roundtable on the questions of our racial analysis, taking an anti-racist lens, and ensuring that we are meeting the needs of our EL learners and our special ed learners, as well as specific neighborhoods of schools that may have some specific requirements that are being highlighted based on that index around equity. And then, of course, what can we afford? What is our budget? What is the way that we have to realign our budget and rethink our budget so that it's nimble enough to address the significant costs we believe that will be on the district to be able to do this well and do it right. We know that it is going to cost a lot more money to do this right, especially transportation, additional cleaning supplies, ordering of windows and replacement of windows, HVAC filters, all of these things, new learning supplies, because children are not going to be allowed to share learning supplies with each other. So there are, a lot of different expenses, of course, technology and technology expenses, new expenses of technology in the classroom if we do go hybrid, and what does that mean? So there's a number of expenses that we know are going to be real. Fortunately, we had some of the funding from the CARES Act that we are able to use. But we and the mayor and the city council were so generous with some of the other supports that we are going to be doing around family liaisons and support social workers and nurses, additional support for our younger children, and then some of our supports around the additions of custodians to make sure that there is cleaning going on, and then our capital improvement plan around water, bathrooms, windows, entryways. So all of that's going to really help us be ready over the next 7 weeks to open up our doors for our children. Again, we are still assessing that exact timeline. So I don't want people getting nervous right now, but every week there will be new information. It will be evolving, and we will continue to inform the public of where we're at and what the actual start date is for school. If we do need to push that off, it will be determined based on science. It will be determined based on the virus and what's happening with that, and it will be determined on our readiness and our comfortability with the readiness. Next slide. So families have been giving us feedback all along throughout this entire crisis. We launched our first survey in April and began to survey parents more in earnest around reopening about a month ago. And so we have been getting and gathering this data, and we have about 10,000 responses so far. And their families are kind of all over the place right now with their comfortability with coming back to school and what kind of model they want. Certainly every single family wants their child in school every day, but it's not a normal environment right now that we are in with this pandemic. So we know that we have to adjust that as best we can. And we don't have all the answers just yet. But about 9% of families still really kind of don't know, can't answer the question because they just really are, just have no idea, need more information. There are about 30% of our families who say that they for sure want to be in person at least some part of the day. 40% of families are saying that they want to do a blended model of having kids in some part of the day and out. And then about 23% saying that they want to be fully remote. Many of the families who express wanting to be fully remote have children who have underlying conditions, or they themselves have underlying conditions, or a family member, a beloved one has underlying conditions, or they just are not in a place to want to have the children back at school just yet. Next slide. So I spoke a little bit about our equity toolkit, and I wanted to make sure that I brought people through what that means in terms of our processes for ensuring equity. The first is really to identify what is the desired outcome and results that we are achieving. Of course, that is, I said at the very first slide, joyful learning environments in which children can thrive. They feel supported, they are supported, and their families are supported. That is really what we're driving for. And we're driving for our students with special needs to have their services, as well as our students who are English language learners, to ensure that they have their services as well. We gathered the data in all of these tracks that I went through the slide prior, and we are able then to better understand where we're at. And then now we're at the place where we can provide preliminary recommendations around a hybrid model. And then bring that to the stakeholders and have them give input over the next 7 weeks. So that is the process. I was talking to a superintendent just yesterday who said they are making their decision and they've had 2 community meetings. I'm thinking, wow, we've had over 21 community meetings in many different languages, and we still have 7 weeks of engaging our community before we come, with our absolute final we'll have more of a final recommendation prior to the start of school, but we will continue to engage our community throughout this entire process because it is such a high value of Boston and our overall community and our overall commitment to equity and transparency, amplifying voice, and cultivating trust. Our strategies for racial equity will come next, which will be really this underlying school leader and teacher engagement and work streams and task forces that we kicked off this past week. And we will begin to engage with them weekly and ensuring that we are applying these new strategies for where we think that we have where we think there are problems because of racial equity, to see if we can continue on with whatever a recommendation is specific to any one of those buckets of areas that I showed you earlier, and problem solve with that racial equity lens. Then as we forward our implementation plan, that will be the one that we will bring forward, and that will be both school-based and district-wide with our remote learning plan 2.0, as well as our operational plan and our facility plan, food nutrition. Accountability and a communication will come next. Rolling out communication, that will start. We already have our reopening website. We already have documents that are out there for parents to engage with. We have our community engagement process, and we continue to move forward with that accountability and understanding from the public, so that we can build confidence in our implementation plan. Next slide. So again, we are working on this hybrid model with our teachers and school leaders over the next 7 weeks. We have ordered our PPE, and we have many orders underway, from HVAC filters for the 30 schools that have HVAC. We are fixing windows where windows need to be fixed. We are working with our custodial staff around cleaning of the buildings and ordering of the materials that we need to continually ensure that our bathrooms are up to par and ready to go. We have dispensers for soap and all of those things that need to be corrected. We've been working on that, over the past couple of months, and more in earnest since school closed, as well as over the next 7 weeks. We are monitoring our budget as we speak, constantly every day, and making sure that we are staying on top of our supply chains to make sure the procurement comes in place with phone calls and every single day. Our human capital office has been doing staffing and staffing up all of our teachers, our social workers, our family liaisons, all of our central office staff, our custodians. So we are staffing up all of our departments. And then we have been beginning our work on routing, bus transportation. All of our buses have passed their safety bus protocol from the state, so we're happy with that. So that's great. And we are working with our protocols around bus cleanliness and monitors on bus and social distancing on the bus, so that we'll have all of that ready to go. And then routing, what routing will look like in a hybrid model, so that buses run on time and can get our children to school safe. Next slide. Our facilities are being walked and upgraded and checked out and looked at and cleaned. We were having a 6 feet protocol in our classrooms and in our hallways and in our, as we begin in our cafeterias, lunchrooms, that sort of thing. Students will not be eating in the cafeteria, they'll be eating in the classroom. So we are revamping our food nutrition services and how we serve our food, and trying to take a really good lens at what does that look like in terms of serving high quality hot meals in school, that are, not totally prepackaged, ready to go. So we are looking at, with our new vendor, around the food and serving of the food to our children in school. Of course, we also will have signage and directional signage and safety signage and visitor signage. All of that will be very clear to everyone within the community. Next slide. So how can families help? That's a question. One, we really do need families to help us. They're going to need to do a checklist for all of us to be safe. They're going to really help us with a checklist around whether their children are well enough to go to school. Sometimes children will come with the snuffles or sneezes or things like that. We're going to ask families to keep children at home who are sick. We're going to ask them to take their temperature at home, and that children wash their hands before leaving the house, that they have their mask on at the bus stop and they are ready to get on the bus. And so we will have all of this available to parents, and they will be walked through this with their school leaders and their teachers, so that everybody fully understands their part in playing, so that we can all stay safe as a community. We'll need them also to bring their learning materials to and from school, because those will be specific to the child. And then also, if parents want to send lunch with their children, that they would bring that. Next slide. We will still have lunch and breakfast at school. So then at school, the safety and operations, of course, there's new routines. Students will have to be walking the hallways. It won't be like a bell will ring in high school and everybody goes out in the hallway. All transitions and groupings will be highly monitored. We will have reminders for social distancing. Hopefully in the little grades, these will be songs that they'll sing and different things like that, that will make it fun and joyful for them. That there will be guides in the hallways that won't just feel like, just lines. We're hoping that there will be colorful stickers and, little froggies and things like that. So we're looking at all of, those ways to try to make our environment not sterile, and to try to make our environment one in which it feels as normal as it possibly can. We're trying to be very sensitive to that. We will not be perfect, but we will get better and better throughout the year as teachers return and create these environments for our children and share best practices. Lockers have to be socially distanced and sanitized regularly. Plexiglass dividers will help us to be able to keep social distancing. It may not be required in every single room, depending on the room size, to have those plexiglass dividers, and we will be basing that again on science. But we will have those available in some of our classrooms. And then also our meals will be served in classrooms. Next slide. We will also have special disposal for our meals and trash, and there's certain protocols that the state has given us around that, and Kleenex and those sorts of things. Health and safety, again, these are some emerging themes that we've heard in the past 20 meetings or so, that, you know, people are worried about the access to cleaning supplies and PPE. They want to be able to make sure that we are addressing trauma and that we have strong cell well protocols, support systems for families and support systems for our adult teachers and community members, staff members within the building, as well as supports for students in this environment. So I think that that is also a point of note that parents have said, what about how do you build community? How do you build connectedness with the community in such a way where people are 6 feet away? So it is on our minds. We have more social workers than we will ever have in our buildings, as well as nurses and our family liaisons who can work with our families. And so we are very much aware of this and working with this expectation from our community. Students will be wearing masks. Again, they're worried about wearing the mask all day. So I know there are some other school districts around the world who have mask breaks. So we are looking at that. And so there are different protocols over the next 7 weeks we're going to do to try to answer some of these questions. And then, of course, we will use outdoors as much as we can, weather permitting, because we know that the virus spreads less in outdoor spaces. And we also know it's really healthy for children to be outdoors. Access to school nurses and counselors, mental health, I talked about that a little bit. Some of the emergent things that we hear about operations is just about the different planning that's happening at high school level and our K-8 schools and elementary schools and our early learning centers. Are you taking into account different protocols and measures at those different age groups? And we are. So I want to make sure people know that, you know, little ones, of course, you know, it's going to require different PPE for our teachers. It's going to require different protocols for what you do with a 3-year-old than you might do with a 17-year-old. Also, ventilation has been a concern for families and the public. And so we want to, you know, let you know that we are fixing windows. The current guidance right now is 1 window per room that can open. And so we are making sure all our windows are working and that we are able to comply with that. And then we only have about 30 schools that have HVAC systems in them out of our 135 buildings. And so within those HVAC systems, they have the CDC guidance is to order filters and make sure that those filters are clean. The opportunity to partner with business and organizations, a lot of partners saying, I want to help, and I love that. So we are working with our partnership office to find ways to, especially in those out of school days times, to find ways to do events with our partners, hoping more field trips would be, small group field trips might be available, more opportunity for small group support for our children and our families. Transportation, again, I talked a little bit already about the cleaning of the buses, but there is still worry out there around transportation and the social distancing. The current guidance just came out late this week, is 1 student per bench. And then they would alternate those benches with 1 person on the aisle and 1 near the window to get greater distance between the students. And then also with windows open on the buses and looking at the cleaning protocols. Some of the emerging themes that we've heard from teachers has been around academics and technology use and doing that at the same time. Fortunately, we have 7 weeks to really work in-depthly with our academic office and our teachers. And we started that work this past week to really engage them around all of the hybrid learning options. Again, I said teachers learn best from other teachers. And so we are going to be digging into what does this look like? You know, are there different models of how we could do the hybrid model with teachers, especially with our students with special education? As you know, when we do inclusion, many times that involves the many adults working with a group of students. So how do we work with the adults in a way that they are collaborating and working on the remote students as well as the students that are right there in person collaboratively? So I know that we will be trying to find these solutions. Also, we were looking on the way that we teach and the strategies that we teach and how we integrate technology in the teaching. How do we use the Zoom? How do we use project-based learning? How do we use field trips? How do we use outdoor space? How do we use the indoor spaces? And how does that guide us around a standards-based education that's required within the state of Massachusetts, and the offerings that we give to students, and how they work on their methodologies of delivering education to children. It's very different for teachers not to have them in a room, circle them up in guiding reading tables, or to have them explore in stations within their classroom and do imaginary learning with one another and play-based learning. Those things are going to be very challenging for us, and we know that this is going to look very different over the next year until we find a vaccine. But we also know that children need to have our best thinking at the table, and so we are committing to you and to our children that we are going to do our best thinking over the next 7 weeks to try to get this right for our children, and I'm anxious to work with our teachers on that. And we also know that there are families who have technology issues, and so we have a parent helpline, and we will be continuing to staff our parent helpline and the support that we give to our schools. One of the things in our budget was, as we rolled out every student for one-to-one, we rolled out also support to schools for technology and technology integration. So we will have that already budgeted to be able to support teachers with their technology and to support families as well. So, but that may mean that we need a little extra support as we go through it, and we will adjust as we need to. As we think about special education, this has been one of the worries that keeps me up at night, just because we have not been able to provide the services that we know that they need due to sheltering in and social distancing and quarantining. And so we want to try to figure out on a case-by-case basis with our families what is best for their family and their children, and how do we best serve them. And it may mean that some of our students need to come more regularly than what has been preliminarily recommended right now at 2 days a week. So we are looking at all of those options right now, and we will be meeting with our families, with our school-based leaders and teachers. Again, we'll continue to engage in this transparent process. We have already, again, had 20 community meetings. We have had focus groups with teachers regarding remote learning, and we are working with our teachers collaboratively over the next 7 weeks to understand better and unpack what we need for hybrid, what we learned in remote learning, what we would need for in-person hybrid if we were to do that model. Next slide. So again, I think I've gone through most of these concerns and recommendations. So, this is mostly about, some of the recommendations I didn't was about family choice. There are some concerns around family choice to opt out. We will have the opt out option for families that want to be remote, all remote. We also have had the request for older and younger siblings to be on the same schedule. I don't know how possible that is, just quite honestly. We are trying to understand that on a case-by-case basis. And we're going to have more in-depth work at the school level once our school leaders are back to better understand schedules and exceptions that might happen from those schedules for families and their personal circumstances, especially for students who are special ed and EL, or from more vulnerable populations like our homeless student population. Foster care population. So we may need to make some exceptions to the rule with that. We also know that we have to, have nurses available in our schools every day. That is critical. So we are looking at our staffing around nurses, and also how do we work with our partners and other satellite organizations in our outdoor spaces to make sure that we are able to get children outdoors. Next slide. We know that there are 3 models that DESE is expecting for us to go through and to report back on July 31st. Then by August, first couple weeks of August, final plans for reopening. Next slide. So our next steps, I shared some of these throughout so that you know kind of concretely where we are. I'll go through this. We are started our negotiations with our union members around our reopening. We are also continuing to share out with the Boston community. We are also continuing to do our equity analysis and with our equity roundtables. Those are all. We also have school-based equity roundtables that will commence once the school leaders are back beginning of August. We also are providing guardrails and designing that with our teachers as we think about our remote learning plan and our hybrid planning. We are monitoring our supply chains. We are continuing our facility upgrades and enhancements, adjusting our plans on engagement as necessary. And again, we will have school-based planning begin in probably mid-August, right after that first week of August. School leaders are going to work with their families and community. They're going to build these school-specific models and begin to start all of the incredible work that's going to be necessary for reopening. And they will submit their plan to us, to their school superintendents for review, so that there's another checkoff of accountability from the school-based plans as well. Next slide. And thank you. And I will take questions.
Thank you so much, Dr. Casilius, for that presentation. I know that was quite a bit of information for folks to process, so just want to take a moment and give folks a minute. And I also want to welcome Tammy Poost, our senior advisor, and really another fearless leader on the COVID front, working tirelessly to support our community around this pandemic. So welcome, Tammy. We're going to transition into the question and answer portion of the agenda. And we had over 100 questions, comments, and concerns submitted through the Google form. And so I'm going to invite my colleague Crystal to support as we alternate a submitted question and a live question. And I can see hands raising. We are at 21 right now, so I just want to manage folks' expectations around it's 10:51. We're going to get to as many questions, comments, and concerns as we can. I also want to say that we may not have every answer to every question today, but please know that you know, the team is working tirelessly to get the answers to your questions and to support the community as a whole. We're going to ask folks to please keep their questions and comments to a minute and 30 seconds to 2 minutes, and I'm going to keep track of that on my end. And at this time, I'll invite Crystal to help and support me with the question and answer.
All right, good morning, everyone. I'm Crystal Cummings, and I'm part of the community engagement team. Thank you for being with us here this morning. If you're unfamiliar with how to use the hand raise function, you should be able to see it right at the bottom middle of your screen. You may have to click participants and then raise hands. So that's how you use that feature. But yes, thank you for your submitted questions yesterday. I'm going to do my best to prioritize submitted questions from that are about our most vulnerable populations, and then we'll take hands in order. So our first question is, what is the plan for children, autism, social, emotional, multi-handicap, who are unable to socially distance? Bolting aggressions out of fear behavior, toilet training, teaching, hand washing will make social distancing nearly impossible. How will their peers and teachers be protected? Are special education teachers going to be put more at risk than regular education teachers?
Well, thank you for that question. It is really a challenge to make sure that we are able to meet the needs of all of our children, especially children we know who are most vulnerable or who may have certain behaviors, and this will be a challenge for us. So we do know that some of our teachers may need additional and different PPE based on whether they have to do toileting or other types of services for children. And so we are working through all of those protocols over the next 7 weeks to ensure that both teachers are safe and our students are safe.
Thank you. And so our first hand raise comes from Jen. There's no last name, but Jen, you are one of the first ones to raise your hand. So I just unmuted you. You should be able to try and speak now. You also have to unmute yourself, Jen. So we'll give you a second to. Jen, do you hear us? If not, I'll move to the next person. Let's go with Sonia Harris Green.
Hello, can you hear me?
Yes.
Yes?
Yes.
All right. Do I need the video or I don't?
You don't have video function right now,
Oh,
but we
okay.
can hear you loud and clear.
All right, thank you so much. This is different. Our regular Zoom. So anyway, thank you. Good morning. First, I want to say that I appreciate this opportunity to have a forum for the community to listen and to express our concerns about our students returning to school. I also want to say that I'm uneasy about my child returning to school, partly because 4 to 5 months since the closure of school, we have to hold community engagement meetings remotely. And also, although our rates of infection are low, I want us to take into consideration that people travel from certain states and communities, which could also expose us to reinfections and new cases. And so my question goes into, can a community member please share its oversight procedures? For example, the checklist that we as parents are expected to facilitate at home. So a checklist at school and a progress report to ensure that sanitization, distance guidelines in the classroom, on school buses, in the hallways, those policies, how is the school district going to ensure that those practices will be adhered to, and if parents are going to be involved in that process to make sure that those safety protocols are being enforced in the schools?
I think that's a very good question, and thank you for asking it. I do think that as we work through the protocols for families, we will make sure that families are aware of what that is, and we will make sure that we have, a video for how families should do that, and a better understanding of the process and how we are going to be checking on whether they, have done that or not. I'm not certain exactly how that's going to work, but I do know that they do have a checklist, and we're working through, of how we would better understand that checklist when they send them. But I don't have that answer. So please, if you could stick with us over the next 7 weeks, we might have a more emergent. I know that there are technologies to do that. There's like ticket out the doors, different things. We have not landed on one way to do that at this point.
Thank you, Sonia. Our next question is, it's more of a concern. I am concerned that continuing online education will exacerbate racial equity issues. According to an article in the New York Times, most private schools are planning to reopen with an in-person education. This means that children of wealthier and mostly white families will be getting a better education, and poor minority students in the city will be shortchanged again. This will continue the structural racism that has plagued Boston. I think the mayor and superintendent should do everything in their power to make the resources available to provide as much in-person education equal to what many private and predominantly white suburban public schools will provide.
So I think that that's accurate, that more advantaged and privileged parents will be able to purchase tutoring and all other types of things, and other families will. We know that that's just a fact, and that has always been the case. So what we want to be able to do, though, is learn over the next year how to do this best for our most vulnerable populations, and to do that collectively as a community. We don't have all the answers right now. We've never done this before. We're trying to do the best we can to get children in school and to prioritize our children that really do need us the most to get back to school. And then also, while we're doing that, learn as we go with new innovations that we know will come up from our teachers, from our partners. We've had so many great ideas, you know, of folks stepping up, and we've been able to see that just through our summer school programming with Boston After School and Beyond, and some of the things that they've been able to do. We have a really unique youth jobs program that we're doing right now this summer in order to get our kids in our buildings doing some of the early work that we need around entryways and things like that. So there, you know, students are doing some remote learning and job work as well. So there are some innovations that are occurring and happening that if we keep putting our minds together and we say, yes, we can, and we really rally because we know the best place for our children is in our schools, that we can figure this out together. And it may not be everybody all at once, but what can we figure out that we can do? And so I am trying really hard to shift the thinking around not just what we can't do, but what can we do? And how do we place children at the front and center? And so I'm really hopeful that we will find new innovations and be able to find ways to move forward, because this unfortunate virus, I believe, is going to be with us for some time, and a vaccine is some ways down the road. And as you can imagine, with the inequity that was just brought up, so many of our children don't have those same opportunities. And we as a community need to rally behind them and figure out how we build those structures for the children to be successful, and what does that mean. And we know for a fact that the children who are most stressed and you know, they're struggling with homelessness, they're struggling with food security, health insecurity, housing insecurity. And we know that those children did not engage as well when we did go full remote, and they are losing learning, and their child development is at risk. So we can't just simply throw our hands up and say we can't do nothing, we can't do anything. We've got to figure out what can we do. And so I'm looking forward to partnering with the community, our teachers and our principals, to figure out what can we do for the children, rather than focus on what we can't do.
Thank you, Dr. Caselius. Our next raised hand comes from Damali. I've just unmuted you. You can unmute yourself. Damali?
Hi, yes. How you doing? Damali.
Damali.
Yes. How are you guys? Thank you so much for having this. I really appreciate it because my nerves are shot right now. I am an asthmatic. My mother is 65 and she's also a teacher in Boston Public Schools, and my grandmother is 92. So one of my questions is it mandatory for everyone to wear masks and gloves? And because everyone is not going to remember to wash their hands, you know, with soap and water, or hand sanitize. I know it's a big question. And I have one more question. I noticed on the survey that you asked, I think, what time was best for remote learning. I can't quite remember. And if you do remote learning, do you guys have a time of what time school will start with the elementary school kids? My daughter will be in K2. And yeah, what time will school start with the remote learning? And I think that's it.
Yes, so we will require hand washing quite regularly throughout the day, and have hand sanitizer available. So I want to make sure that you know that. I also have a son who has asthma pretty bad when he was little. And so I know your worry there. So and then in terms of the schedule, you know, we don't have each individual school schedule worked out yet. That will largely be driven by transportation. But currently we are going to be really reassessing all of that. I mean, so just know that you'll learn from your school what that looks like in terms of the remote learning, because we did have more of a condensed schedule for remote learning in our remote learning guidance. So once that comes out over the next couple of weeks, I know parents are anxious to know. We'll get that to you.
Thank you. I'm going to summarize a couple questions, similar questions that came up, which is essentially, what is the protocol for a student or a teacher that is diagnosed with COVID? What is the school protocol?
I don't know if Tammy's on, if she wants to speak to that, but I do think that we are still working through some of those details with the city around a really concrete policy for what we will be doing. If a student is sick, obviously they will go to the nurse, they will be isolated, a parent will be called, they will be picked up. That is necessary. I think we are still working through whether we will be doing our own testing or whether we will require testing. Tammy, do you know, do you have more information from the city on that, or should we?
I do.
Okay.
We actually met yesterday on that for another hour or so, and we continue to work on it. So let me underscore what the superintendent said, though. First of all, it's not just that the teacher needs to handle it themselves. That absolutely would be unfair. We have guidelines that our student health staff has worked out and is working out with the Boston Public Health Commission with regard to when a teacher sends a student to the nurse, either because it looks like they have the flu or something else doesn't seem right. The nurse will have strict protocols on evaluative measures that are specifically related to COVID. Our nurses don't have the ability to test themselves. They're not healthcare professionals that can provide actual testing facilities. But if a checklist of symptomology indicates that the student should be tested, we will have immediate ways to get that student to either a testing site, or we're actually working on having a mobile testing unit that would come to the school. Why is that? We understand that a lot of parents won't have the ability to get their student to a healthcare provider immediately to be tested, and we need to do that so that we can contain the number of students, either the classroom or the floor or the whole school, that needs to be contact traced back to make sure that we haven't inadvertently allowed any exposure from somebody who tests positive. And then, of course, if we do have a positive test, then there are public health guidelines that we will absolutely enforce with regard to when people can come back into schools, and it won't be until after the appropriate quarantine period. All those guidelines will be in writing and released to the community as soon as we have them. So you won't need to simply take my word for it that we have them. We'll be able to give them to you so you can see them. They're not quite done yet, but they're close, I would say, in the next 2.5 weeks.
Thank you, Tammy. Our next raised hand comes from Nadia Wahid. I've unmuted you. Nadia Wahid.
Hi, just wanted to ask a question. So I'm a Boston Latin school parent, and I really think that BPS needs to take a more nuanced look at the reopening schedule. The hybrid model may be good for smaller children, and indeed, in-person schooling is essential for kids who are smaller, but as far as high school goes, it may end up being a learning disaster. And so I really do want us to kind of challenge the idea that the best place for all kids is in-person school, because the risk-benefit conversation is entirely different when you start talking about high schoolers and what high schoolers really, the density of information that they need to learn during this time, and the disruptions that will be caused by quarantines, of potential fall surge, switching back and forth. Specifically speaking about BLS, if half the grade is in person and the other half is spending 6 hours in front of a computer screen watching the teacher and their classmates, it won't work. It won't work for students, it won't work for teachers. So just really, I feel like, a lot of this conversation is focused upon younger kids, appropriately so, because they're, the largest part of our district, but also that we really need to think a little bit more about giving autonomy to, schools to be able to think about what they need.
Yeah. So I'm glad you brought that up, Nadia, because high schools will be on potentially on different schedules. So I don't think I was clear on my presentation well enough to distinguish between K-8 and high school. So high school principals will be meeting and looking at their own personal schedules. They'll be looking at their space and determining which classes will be online and which classes will be in person. And what student schedules will look like. So I just want to make sure that, because they're all so unique. A vocational experience is very different than it might be, at BLS or at one of our open comprehensive high schools or one of our smaller, schools around leadership or social justice or something like that. So, or our alternative schools. So I met with high school principals really specifically around scheduling just this past week. They're putting together a small group. So we will have more information around high school scheduling over the next couple of weeks. Thanks for bringing that up and helping me clarify that for folks. I don't think that was clear.
I do think there's another piece of that the public should hear and think about as well. In the survey that we did of actual students, the students that were in grades 3 through 5 actually reported the best experience with remote learning. And the students that reported having the most dissatisfaction with remote learning were our high school students. And so we need to honor that as well. And we're trying to work that through with our school leaders on that level.
And it was grades 3 through 5, not
Correct. Sorry.
not ages 3 through 5, just to
Correct.
make sure.
Thank you. And I just because we're on this topic, I'll share this suggestion. It says, my suggestion is having half of the students go to school in the morning and half in the afternoon. The exception would be the vocation week at Madison Park. All students should be in person during vocation week, but maybe stagger the arrival and departure times by 5 to 15 minutes to keep entrances more manageable. Also, 1 to 2 days per week could be virtual, except for vocation week at Madison Park. They need in-person learning for their vocation. So I just wanted to highlight that on behalf of that school community.
Great, thanks. That's a good, we've been looking at all different solutions. And so having all of these suggestions are really good to have for consideration. I do want to talk just briefly, and I don't know if Monica is also on the call around, I don't think I also covered as I'm thinking about just assignment and choice. I do think that, I quickly talked about, parents having the ability to opt out. Given Nadia's question around, remote learning, it just triggered for me that parents will have the option to do remote learning. So I wanted to make sure that was clear. I also think it's really clear to, to have Monica talk about just registration and choice. If just for a minute, Monica, you might talk about that in terms of your spot and when we can anticipate, decisions around assignment and really parents, getting questions if they do opt out, can they still have their spot and that kind of thing.
Yes, good morning, everyone. Registration is underway. Anyone who registered, I believe, prior to the month of June, so between February and June, should have received their assignments the week of July 17th. Anyone who came in July, between July and the first week of August should receive their assignments during the month of August prior to the start of school. We're working really to make sure that families are able to get those prior to September 10th. In terms of opting out, we're working currently to develop a process that will allow to track which families are deciding to do remote learning versus who's choosing to go to school. Either way, you're still going to be, your child will still be seen as a student within that school. So opting to do remote learning does not mean that you're losing a seat in your school. Families will absolutely retain those seats. It's just about where you're getting your education. So the physical location of where the child is getting their education will not impact the seat in those schools. And I will also say there are lots of families who we think have not registered. So if you know families who haven't registered, we are taking registration by phone, trying to make it much easier, and our centers will reopen on August 17th. So please encourage folks to register so that they can start on September 10th with the rest of their peers.
Thank you, Monica. So now we're going to take a raised hand from Peverly Lawler. Peverly, you should be unmuted. You can share your question or concern now. Peverly Lawler.
Hello, can you hear me?
Yes.
So I had the same question as Damati. I probably pronounced her name wrong. I live with like vulnerable people, and my kid has asthma, and he's 5. He kind of has like a little bit of behavioral issues sometimes, and doesn't always wash his hands all the way, and he has trouble keeping his mask on, and like when it's like, flu season, he gets really sick. So I was wondering if there's gonna be like specific people in the classroom in case, the littler kids, because he's gonna be K2, have to come back, like, to make sure that they properly wash their hands and are like, properly keeping their mask above their nose and all that. And if the kids, the littler kids are gonna have the plexiglass in the classrooms, just because, my kid is, like, he would, I try to remember him all the rules I have to remember now, but he's 5. So it's like really hard for him to keep it all together.
Yes, our little ones, this is one of the things I've always been worried about, because we know how little ones are, right? They usually are pretty compliant, but at times they're not. And so we know that. Fortunately, in our K2 classrooms, we have supports and paraprofessionals who are supporting our students. And we also have those throughout all grade levels. Oftentimes other adults in the classroom. We do know that group size will be limited within our classrooms as well. So, it won't be your typical, 30 kids in a classroom or 22 kids in a classroom. It'll be much smaller class sizes. And so that should make it a little bit easier to manage. And of course, as you are 6 feet away, we know that that will help as well. So we'll continue to teach kids protocols around hand washing to make sure they know how to hand wash appropriately, and hopefully with fun singing and doing different routines for them as they do those hand washing. So we'll keep working at it, and we do not want this to be a punitive environment at all. So I want to make sure that we will be gentle. Teachers are always gentle, typically. And so I want you to know that we'll be working to support our teachers and working to support our students as well through all of this, really, as we all learn together how to do this safely and how to be in this new normal. I think that's going to be critical for all of us. And thank you for your work with your son and children as well, and everybody on this call for being patient with your children as they learn this new normal. It's scary for them. They just want to go out and play and hug the other kids. And I know I've heard stories of children who are just breaking down because they really want to be with other children and they want to play. And there's some emerging studies that are coming around when children have these play groups or peer-to-peer buddy groups that are now popping up, so that they can play with one another safely in little family groups. And so I think that is going to be more important for us to learn about and to study and to better understand. So thank you for bringing that up.
Yes, thank you. Dr. Caselius, there are lots of kind of questions and concerns around what, if a hybrid model is chosen, how teaching and learning will look, how simultaneous teaching and learning will look. So, will the students at home kind of be in front of a computer screen? How will we prevent teacher burnout? Will teachers be teaching both groups at the same time? Those types of concerns.
Yeah, I think this is the biggest worry for our teachers. And I've been hearing it more and more as we've been talking about hybrid model. They didn't like remote learning, and I get a sense that they're more troubled about hybrid and concerned about it, just to be honest. So I think that that's real, and I want to unpack that with our academics team and our teachers over the next several weeks to better understand their concerns. Obviously it's access to technology. Nobody likes to be in front of a screen every day. Just like I said to the parent just now, everybody wants to, we worked hard. We've worked hard over the past couple of decades to not be in front of the classroom, to not have kids in rows, to do more center-based learning, to do more project-based learning. And this is a step backwards from that. And this is a step backwards from what we've been telling teachers on how to teach. And so they have been getting down on the rugs and doing manipulatives with students when they're learning how to do their math numbers and grouping, or they might do imaginative play. They might go outside and play games and do exploration and do studies within field studies. And this is just very, very different for them. And what I think we're seeing is teachers saying, this is going to completely impact my practice. And they're frustrated by that, you know, and it's almost like the 12 steps of grief, right? You know, for you first have to, you know, accept, I don't even know them all, but, you know, it is really like the 12 steps of grieving, because we have to all accept the new normal that we're in, and we don't want to accept it. And we're angry about it. And I completely understand. I am angry about it too. I do not want to be in this situation. But I also don't want to be in a situation where I have children who are 2 years behind in their education, because you can't catch up. It's just too hard. I mean, this is why we do universal pre-K. This is why we get children preschool, because we know that they need this step up, especially our children who are most vulnerable. So that's why I'm saying, how do we get to what we can do together? And how do we get, you know, move on to thinking about and accepting our new reality so that we can move forward and figure out what we can do. And I know that that's a hard message to hear. And maybe we need to work through these stages of grief first. And I need to be patient in that. And I will take as much time as we need to make sure that we can do it safely. But to think that we're going to open up day one and be perfect is not going to be the case. I have said to teachers in my check-ins that I do with them and do with all the staff, we will not be perfect, but I'm not expecting you to be perfect, but I do want you to try. And so I have said that to my team, that we all have to try, and we all need to dig in and figure out what we can and what we can't do, and be very realistic about it. And so we'll be doing that over the next 7 weeks and really earnest. But what we had to do first before getting to this place was really assess where we've been. And what we know is remote learning is not the best delivery of a high quality education for our children. So some amount of in-person, I believe, is the best. But we can't do that until we're safe. So now what we've done the past many weeks is, can we do that safely? We've determined that because the virus is at one of the lowest rates across all of our nation, that we think we can. We think we can get our buildings ready. We think we can put in place protocols to keep children safe. The science tells us we can. It's happening across the world. Other nations are opening. And so we need to figure that out. Now, can we do it every day? We don't think so. Can we do it for all kids? We don't think so. We've already said that and admitted that. But what can we do? And so that's the place that we're at over the next 7 weeks. And if at the, if on, September 10th, we think we're not ready, well, then we're not going to be ready and we're not going to open doors. But if we think we can be ready for some kids in some incidents, in some way, then we're going to open our doors and we're going to do that. And so that's what we're trying to understand now over the next 7 weeks. And I hope people will really work with us in better understanding that, keep raising these really legitimate and valid concerns and understandings of where we're at, so that we can know better what we need to plan for.
Thank you, Dr. Caselius. We're going to take a raised hand from Ashley Clerge. Ashley Clerge.
Hi, can you hear me?
Yes.
Hi, my name is Ashley Clerge. I'm currently a teacher in East Boston. I just wanted to say thank you to everybody for keeping equity at the front of their minds when it comes to just reopening and being really thoughtful. I think it's so important. But I just wanted to highlight a point that you made about there only being 30 schools in the district that actually have an HVAC system. And the CDC recommendations hinge on the fact that schools have proper ventilation. And I know that my school is not one of them. And 70% of Boston Public Schools are reported as having poor ventilation. So I guess my concern is, will we be able to install HVAC systems in approximately 100 schools in just 7 weeks? Just because I know in my school, I'm still waiting for my classroom to be built. It was supposed to start in May. It's still not finished. And yes, I just want to know what is the plan to make sure it's done safely. Just because, again, like the ventilation is key to keeping us safe.
Yeah, I wonder if Tammy, you can speak to what we've done so far and what the current CDC guidance says around HVAC systems. You're on mute, Tammy, because it just wouldn't be a meeting on Zoom if we didn't have to remind somebody.
Sorry about that. Really, I should know that, and we all should. Sorry. But again, thank you for raising that question, because I know that that question is rampant throughout the community. So here are the actual facts. The CDC guidance and the DESE guidance that just came out last week do not require forced air ventilation in every building. And why is that? It's because most school districts throughout the nation do not have them. In Boston, we do have forced air ventilation in 30 some of our schools, as the commenter just said, and so, which means in 90 some schools we don't. And there is no requirement, and there's no practical way that schools throughout the country could put in HVAC systems in all of their schools in the amount of time that we have. But it's not necessary, according to the CDC and the DESE guidance, which say if you don't have air filtration, mechanical air filtration systems, what you do need to have is airflow in every building. And they specifically call out appropriate airflow from opened windows and open doors. And so that is the basis of the audits we're doing of every school building to make sure that we actually have the ability to do that in every classroom. And in classrooms where we don't, we'll simply have to say those classrooms cannot be used because they can't meet the guidance.
Thank you, Tammy. And I just want to do a quick time check. We have about 5 more minutes on this call. Denise, should I share one more question from the submission pot?
Yeah, how about we take one more submitted question and then one more hand, and then we can close out. I just want to say that there are 55 hands still raised, and we know that there are a lot of questions and comments and concerns and suggestions. You received an email from us yesterday with a Google form where you can also submit a written suggestion, comment, or question, and all of that information will be shared with our leadership here, as well as the teams working on planning. So again, if your question is not answered today, we understand this isn't the ideal way to engage with community, but we still want to hear your questions, comments, concerns, and suggestions.
Thank you, Denise. So Dr. Casalius and Tammy, there are lots of questions kind of around transportation. Can we elaborate a little bit on what taking the bus will look like, and also our partnership with the MBTA, especially for our older students?
Sure. Do you want me to take that one?
Yeah, why don't you go ahead, Tammy?
Okay. So right now the guidance from the Council of Great City Schools is that we have no more than one kid per bench per bus. And that means that we can't transport as many kids on a bus as possible, which means, which really is what leads us into needing to have some hybrid model where half the kids can be there while others are not. It's not about necessarily being able to get them in classrooms. It's about getting them to the school building. So here's how it will work. And these are written protocols that, again, we're finalizing, but we will have and we will send out to people broadly so that you can have input. Kids will get up and they'll be encouraged through training of families, through communications that we give, to make sure that they do thorough hand washing at home, and they will have a mask because we're providing it. So the kid then gets on the bus. At the getting on the bus stage, there is another hand sanitation station on each bus. The kid will have an assigned seat on the bus so that we can keep one kid per bench per bus. We're trying to hire more bus monitors. If you know of anybody who wants a job as a bus monitor, those positions are posted, please apply, because we'd like to have a bus monitor on every bus in order to help enforce social distancing and make sure that that kindergartner stays in the assigned seat. When they get to school, then there are protocols for kids getting off the bus in a single file line, as of course you have to in order to get out of the one door on our school buses. And there will be marked areas where students will stand in a socially distant line and supervised by a staff person until it's their turn to go into the building. And then they'll walk into the building and there'll be another hand sanitation stations in the entryways of each building, so that if for some reason somebody skipped on the bus or lick their hands on the bus, whatever, they wash their hands again, they sanitize their hands again before they then go up into the classroom. And going out is the same way. They come back out, they get into a line, they're taken onto the bus, they sanitize on the bus, they sit in their assigned seat, and they're taken home. That is overall how it looks. Now we have lots of deep cleaning of buses every night, including disinfecting and between routes. And so the one person who suggested maybe we could have morning school and afternoon school, one of the problems with that is we can't sanitize the buses between morning and afternoon school. There's not enough time. And that's how important we think it is to sanitize buses. So we'll have a lot of written protocols that we'll get out to you. I know I'm talking really fast. I know we're at the end.
Thank you, Tammy. Dr. Casellas, did you have an additional?
I think we have time maybe for one more.
Yes, one more hand. And before we do that, I just want to share that there was a student that submitted a question, and ultimately this first grader wanted to know, will we be able to hug and high five our friends? So I just wanted to share that, you know, joy is definitely part of all of the planning, and that Dr. Casellas's.
At this point, there will be no hugging, unfortunately, maybe virtual, you know, and, you know, this kind of, we'll figure out something though. You know, sometimes teachers have figured out, you know, clapping and different kinds of things in the classroom that can feel almost as good as a hug, but not as well.
Yeah.
So we'll work on that. I'm sure our teachers will have great ideas around how to virtual hug.
Thank you. Our last hand comes from Eugenia Corbo.
Oh, hi, I'm here. Can you hear me?
Yes.
Okay, I'm gonna be quick because it's actually 3 questions, but I think they all require very short answers. One is this opt-out version. If I assume a kid has to be quarantined because somebody at home was exposed, kid at home was exposed, can that kid shift from being in school to being on this opt-out system fully remote for 2, 3, 4 weeks, whatever is needed, so they don't fall behind?
Yes.
Yes, that's an easy one. Another one, cafeteria spaces. If they're not going to be used as a cafeteria, will they be used for additional PE? Kids need to move. I have a highly energetic 5-year-old. Will that be like an extra recess space?
Definitely we'll repurpose them. It will just depend on the school and what they determine to repurpose for their PE, but we are not getting rid of any PE and art and that kind of thing. I mean, we still know that that is so important to the child development of our children. So,
thank you. And a question about food services. Our school had My Way Cafe, which is a wonderful. It's Boston EEC. My husband has been helping every week deliver meals to families in the neighborhood that cannot get to the BPS pickup side. So we've had a chance to see the type of food that's been given out from different providers, and the quality from different providers has varied quite a bit, with particularly one provider looking quite sad in terms of quality. So what are we doing to ensure the nutritional quality of meals that are going to be served in very unusual circumstances?
yeah, thank you for that question as well. It's just on our mind too. Food security is something that I really have as a priority as a child who grew up on food stamps in my early childhood. I fully understand the need there. And so I think that, you know, we are going to be looking at the quality of the food. The My Way Cafes will still be a huge partner of ours moving forward. And so unfortunately, because we are in this COVID response, we have had to serve more of like emergency food than what would be a typical service of delivery. We also didn't have refrigerated busing with a lot of the deliveries that we did to food, which then you had to do shelf stable meals for. So we have shifted vendors, and we have the opportunity now to really look at, and are working nationally with 14 other large urban districts to look at the quality of food in this COVID response, and what does that prepackaged food look like, and how do we design menus and ingredients in order to improve the quality. So thank you for bringing that up. It is a very important piece of what we want to do moving forward.
Yes, thank you, Eugenia, and to everyone who shared their thoughtful questions and concerns. And I'm going to turn it over back to Denise Rory.
Go ahead, Denise.
Thank you so much, Crystal, for helping us to facilitate the Q&A. You did a great job. Dr. Caselius, I'll let you have the last word of the morning. Thank you, everyone, so much for your time.
Great. So I just want to, thank the entire team for organizing this webinar. I know that we typically have smaller groups and we had to quickly shift. So, we apologize. We had a lot more people sign up than we had anticipated. So we moved to a webinar format. We will probably try to figure out how to do submission of questions, how to do these webinar, maybe YouTube or Facebook Live type of streaming as well, so that we can make sure that everybody hears the information and then also has a way to enter in questions and stream the questions. We are learning as we go as well. And we want to have really great listening sessions so that we can get all of these really great ideas lifted up and address them. And then we also will have what do you call that? A roving TikTok around questions and answers, right? FAQs, that's what it is. So we will take those, and then our wonderful team will have on our website, on our reopening website, a lot of these questions, and we will answer them so that people can then have ongoing FAQs and have answers, and then they'll know that when they come to a session like this, that will be answered the best that we can. Now, I do want to ask for people's patience, because certainly, like I said earlier, we do not have all the answers just yet. And so we need your help in lifting up those things, as well as working with our teachers around simultaneous learning, working on hybrid models, working on remote learning models. What does that look like? So we are going to be figuring that out. And I wish I really do wish we had the answers. It's all new to us. And so there has to be a little bit of discomfort in terms of how we, forge ahead to try to better understand where we're at. And it's just, if it's a known, if we had been trained in college for it, everybody would be ready. And, or if we had, it's all so new. So please be patient with us as we begin this really more in-depth engagement process over the next several weeks, and also engage with our teachers to get more answers around what does this really look like. And then as we move into our buildings in August and begin to, show all of you the work that we're doing. So with that, I'm going to turn it back over and just thank the team. Thank Tammy for coordinating all of us and keeping us on track and checking the boxes and the T's for us, and then raising it up to the city and other partners to help us problem solve wherever we can. And then also thank you to all of the parents, all of the students, all of the community members, and our teachers and our staff members who are on this call today, who I know are going, oh my goodness, this is just such a big lift. And it really is a big lift. And I know it's a big lift. But please let us know and keep letting us know how we can support you in that as we build what we can do with our community moving forward. So I'll turn it back over to you, Miriam, and then you can give the next steps and where we're at and where they should go for more information in terms of our website. So thank you again.
Thank you, Dr. Caselius, and thank you, Denise. Thank you, Crystal, Jelani. Special thanks to Rhiannon. Everyone can visit the Boston Public Schools /reopening page, where all our future dates and meetings are posted, and registrations links are there as well. Thank you so much. Have a wonderful day.